Hi, everyone. My name is Alicia, and I'll be taking you through today's ClinicTracker community training series. Today, our topic is billing tracker for billers, excuse me. Before I get into today's topic, I'd just like to take time to introduce myself. My name is Alicia, and I'm here as one of the product experts at ClinicTracker. And my goal is to make sure that you make the most out of your ClinicTracker and billing tracker features. And toward that end, I'm happy to answer any questions that you have about today's topic as we go through. You can answer those, or excuse me, you can ask those questions by either raising your hand and I'll unmute your microphone, or on the GoToMeeting panel, you'll see a questions area where you can type your questions in. Okay, after today's meeting, after today's topic, I'll open the floor to any system-related questions. So even if it's like a workflow builder question, save that for the end, and I'm happy to address any of those system-related questions. Okay, after today, if you have questions, you can send them into our support team. You'll also notice my email is here at the bottom of the screen. Okay, today we're going to be going through billing tracker for billers. And we have a few goals. So we're going to try to help everybody understand how information flows from ClinicTracker into billing tracker, and how that information can be used for things like the claim charge calculations, options like claim combining, modifier rules, override rules, etc. And then finally, we'll talk about the options for submitting those claims once they're created. Okay. If anybody has specific scenarios they want to make sure I cover today, billing questions that they have, or real life examples that they would like me to use as I go through, go ahead and put them into the questions panel now so I can see them, and we'll make sure to address them as we go through. Okay, so first we want to talk about the flow of information from ClinicTracker to billing tracker. Okay. I do have somebody that said they're having a problem with audio. I just want to take a pause and make sure everybody can hear me. Somebody could just confirm in the questions box that they're hearing me, I would appreciate it. Thank you, Casey. Okay. Okay, I think we can kind of keep moving here. Oops. So the flow of information from ClinicTracker to billing tracker, we start right here at the scheduler. Okay, and a lot of times clinics use that scheduler as a calendar. Their clinicians are putting the appointments in ahead of time. You can allow your clients to schedule on the patient portal. All kinds of ways information can get into that scheduler. Okay, once it's in the scheduler, it's going to include information like the client name, the clinician, the service, the program. We're going to use all those to create what's called the linked appointment, and that can happen either manually or your system can do that automatically for you based on the settings in the options form. If you don't use the scheduler, perhaps your clinicians are just typing directly into this form, which is okay too. Okay, so the appointment record is what's going to feed the claim that's going to be created later. Okay, so you can kind of see the scheduler is an optional first step. We need the linked appointment in order to transition into a claim. Okay, you can also manually create claims. Okay, and I'll show you briefly how you can do that today. Okay, once the information goes into the appointment record, there's only certain appointments that are going to be eligible for billing. Okay, so the client needs to be billable on their demographics form. Okay, on the financial tab, you'll notice there's a not billable for any services checkbox. If that's checked off for the client, none of their appointments are going to show up in billing tracker. Okay, if the patient group in the maintenance menu is marked as non-billable. Okay, so if the patient group in billing tracker is marked as non-billable, then that appointment won't go over for a claim. So we need to make sure the patient group indicated on the demographics form is in fact billable. Okay, we also, need to make sure the program is billable. So the program on the appointment record that you select, it needs to be a billable program. Okay, the appointment record, there's a checkbox, which you'll see in a few minutes, that you can set as do not bill. Okay, if that's checked off, appointment's not going to show up to transition. Okay, the status needs to be a showed up or cancellation status. Okay, showed up or cancellation. Keep in mind you can put in your custom showed up reasons in the maintenance menu, and those would qualify. Okay, if we want to block a claim from being created for certain reasons, we can do that. Okay, so program requirements in general, or sorry, for progress notes. So we can block on transition, meaning we're not going to let a claim be created if that progress note is not signed by everybody who needs to sign it. Okay, we're just not going to let a claim be created. Or we could warn the user and say, hey, this appointment doesn't have a progress note. Are you sure you want to proceed? Okay, and then some clinics don't block at all. They just say, we're going to trust that the clinicians will get it in there and we'll go ahead and send the bill. Okay, and then you have specific payer requirements. Okay, so those payer requirements might include things like the diagnosis code has to be present, or the clinician has to be credentialed with that payer. Okay, so you'll see where to set those today. Okay, okay, and then we have modifier rules. Once we start to transition the claim, those modifier rules are going to be applied. Okay, so we'll go through and we'll look at anything here. Okay, and then the fee will be calculated. So we have things like, are we direct billing the client? So on the appointment type, you have an option to say this kind of service gets billed directly to the client. So if that happens, we're going to calculate based on the self-pay rate. If you have an override price in the appointment record, so you have the ability to override the price of the appointment rate in the appointment record. Okay, then we have reduced fee schedules, cancellation fees, and then there's patient-specific fee schedules in there. So anywhere here, the fee schedules, if it's patient-specific fee schedules or insurance-specific fee schedules. We have cancellation fees for any of those cancellation reasons you put in. And then finally, the default unit price, which is configured on the service input. Okay, so you're going to see how to configure all of these in just a moment. It's actually pretty easy. Okay, once the total fee is calculated, we include modifier adjustments as well. So if I go back up to that modifier rule setup, you're going to see there's a fee adjustment box right down here at the bottom. Okay, so once the unit fee is calculated, we're going to add in that initial claim charge plus modifier. Okay, we're also going to then calculate things like unit based on time, and we'll get the total claim fee. Okay, once the claim fee and override rules are all configured and applied, that's where we can start generating the actual claim files. Okay, so that might be a CMS 1500, a UB04, or an electronic claim batch is what usually our goal is. Okay, so the system is going to look at things like claim combining rules. Do I combine all the paper claims that have the same data service for the same patient? And how do I do that? Okay, the claim type, is it paper, is it electronic? Okay, if it is electronic, is it going to a clearinghouse, or is it going to a payer directly? Abby, I see your hand up, so I'm going to unmute you. Abby, are you there? Okay, I don't think Abby can talk to us or hear us, so we'll kind of keep moving for now. Okay. Like I said, once you have the transmission type configured, we actually look at any applicable overrides kind of in this process. So, things like, do we need to change the service location? For example, if it's a telehealth, do we need to change the service location type? Okay. Under claim submission, um, we have different options for submitting the claims once they're created. So we can do the FTP to the payer or clearinghouse. So that's a secure file transfer. And then we have, you can log into a portal and submit the batch file that was created. You can print paper claims or ensure patient statements. Okay. All that being said, we'll dive into the system and take a look at everything that I just talked about today, and look at how we can kind of apply those things in the system. Okay, so starting right here in ClinicTracker, a lot of our configuration is in here. We need to make sure that we set up our items correctly so that our ClinicTracker workflows feed our billing correctly. We start by doing that, we start doing that by coming here to utilities and then maintenance. And there's several things that we need to configure. I actually mentioned them as we went through. So one of the first ones I look at is service input. Okay, on the service input form, this is telling me the CPT code that I use by default. It's telling me the unit price, and it's telling me the unit calculation. So it is the billing interval based on time. Okay. Okay, and if it's based on time, you need to enter the interval in hours. Okay, and this is where you can say a 15-minute unit is 0.25. Okay, next you can set your rounding rule. Okay, you can look at these by looking at the first letter first and the second letter second. So an N means nearest, up or down. U means up only. It won't go down. It only rounds up. Okay, D means down only rounds down. Okay. Next, we have the second letter. Q means quarter unit. So it's going to round to the nearest quarter unit. Okay. T means third unit. So this would round up to the next third unit. H means half. W means whole. Okay. Okay. Notice that here's that setting for bill the patient directly. Okay. So if this is a service that's billable directly to the client, insurance doesn't cover it, you can check that off here. And the client would be billed as opposed to the insurance. Okay, so I'm gonna close out of here. Does anybody have questions on the service input? Okay, I'm just pausing to see if anybody has questions on the service input. No, okay. So we'll kind of close out of here, oops, and here, and we'll come right back to this maintenance menu, okay? And we're gonna look at the program. Okay, so I mentioned the program input. Okay, remember that this program needs to be marked as billable when I select it on the appointment. Okay, same for patient group. Just still in this maintenance menu, typing in patient group. Okay, and here's that billable group setting. Okay, last while we're in here, I'm going to show you the building setup. This is actually going to be really important when you select your place of service on your appointment record. It can be used for billing. You're going to want to ensure that you have a proper tax ID and NPI, that sort of thing. Okay, any questions on the maintenance menu? Okay. Okay. Just a side note, this is also where you enter new payers. So you can come here to the insurance input form, and this is where you could click on them. And you can even set up your billing setup right from here. But I'm going to go in a different way through Billing Tracker in a second. Okay. Last thing I want to show you on the staff setup, or sorry, on the ClinicTracker setup side is the staff info record. So staff info. It's going to be important to ensure that you have your staff records set up correctly. This information flows over with the appointment record. Okay, so things on here like the NPI, license number, etc. Whatever you need to have on that claim needs to be filled in here. Okay, notice that there's a bill under supervisor setting. This setting is going to cause the system to always use the supervisor listed on the appointment record for services that this person performs. That's going to be useful if you have an intern or somebody that always bills under somebody else's NPI. Okay, if you have somebody who sometimes bills under somebody else's NPI, we're going to cover that in our override rules later. Okay, so you would not check this off for the sometimes people. Any questions on the staff setup? No. Okay, so let's walk through this process. I talked about the information goes from the scheduler to the appointment to billing tracker. Okay, so I'm going to come here to my schedule. I'm just going to add an event to my schedule. You can see that I have a default location, so it's going to use that building's address. Oh, I see we have a question here, so I'm going to pause and unmute Kristen. Kristen, what's your
Hi.
question?
Yeah, my question was going back to the other form you were in for the staff info. So what if your staff, you have it where you have building location. What if sometimes they're telehealth and sometimes they're in office? Do you have to, I guess, see you have a red stop there. So do you have to set that for a certain type?
So this building is just kind of telling the system where this user normally is. So if they're doing a telehealth, it's not, you can still choose telehealth a different location on the actual schedule.
Okay.
Does that make sense?
Yeah, that makes sense. Thank you.
Sure thing. Any other questions? I don't think so. So I'll go ahead and mute you. Just raise your hand again or type in your question if you have any more. That was a good question. Oops. So I'm going to come back to the scheduler. I'm just clicking my schedule. Okay, I'm going to double click again. And then I'm just coming over here to where it says event type. This helps me color code the schedule. That's also in the maintenance menu if you want to set that up. I'm going to click here where it says plus, and I'm just going to choose one of my clients, fills in the description for me. And once I have the client selected, you'll notice it fills in their primary payer, but if I need to choose like their secondary payer, I can. Okay, I can indicate the program. This is going to be important if you have any program-specific billing rules, like a program-based NPI. A lot of case working programs have their own NPI, so we might want that. Okay, the service, remember that's going to be important. It tells the system what CPT code is going to go over. And then finally, the payer is going to be important because we're going to assign balances and create claims based on the payer selected here. Okay, when I'm done, I can save and close and let the system come through and create the linked appointment. But for now, I want to hurry through, so I'm going to click Create Linked Appointment manually. Okay, that's going to take all this information from the schedule, and it's going to bring it right over here into the appointment record. Okay, so you see it fills out all of the information I need for me. So the clinician name is going to use my NPI, unless there's a billing rule that gets applied later. Here's the program, the place of service, all of this going to be used for the claim. Okay, we need to mark this item as showed up or a showed up status in order for it to be billable. You'll notice this turns green now. Okay, if the client has an authorization, I can click in here and it's going to enter in the authorization code. There's also settings in your options form that say, as soon as I change the status of showed up, enter in the auth code. So you could toggle that if you didn't want your users to worry about it. And then they could come down here and create their progress note. Okay, we're going to pretend I created a progress note and save this record and say now it's ready for billing. Okay, any questions before I move away from the appointment form? Okay, so now we're ready for billing. Okay, so I'm going to go over to the billing tracker system. Okay, and we want to transition appointments, it's called. So basically what that means is it takes all the information in ClinicTracker and it transitions it into a claim based on a lot of things. And I explained those things when we were going through what those items might have been. Like, is the progress note there? Yes or no? If it's not, we're going to block it. So I'll show you how to set that. It's under settings and then options. And then the very top option right here, where it says progress note requirement upon transition, you can see mine is set to none. So it means that I have no requirement. In my demo system, I can transition appointments to be a claim without a progress note being completed. If in your system you'd prefer to block that from happening, you would just change this option to block. Okay, what you're also going to notice is that you do have the option to have patient group specific settings. So let's say you have a patient group where you just don't require those progress notes. You could actually override your global setting. Okay, any questions on this option? No. Okay, next we talked about plan requirements. Oop, Kristen, I see your hand up. Hi, Kristen.
Hi, so I noticed that in my system I have none, but I know that my claims don't transition over at all unless there's been a note put in there. So
So
how
what
is that happening?
what you might want to check is here where it says show list.
Hmm.
Choose the patient group and see what it says. If it has an override here, it's going to block it for that patient group.
Okay, let me take a look. So it doesn't have a patient group listed. It just says requirement use global default. So like nothing's been input, but I noticed that if a note hasn't been like made or signed, it won't transition over.
Okay. I think if you could send in an example to the support team, we could look at it kind of more in depth with you.
Okay, sounds good.
Thank
Thank
you.
you.
Thank you. Okay. So I'm just going to keep going here. We talked about these. I'm going to close out of here for now and we'll talk about the plan requirements. So these are insurer specific requirements as opposed to like system wide requirements. That's here under settings and then insurer plans. Okay, you'll notice that's this is the same form I pulled up earlier when I was in the maintenance menu and I said you could access the billing setup from here. This is just another way to get in. Here are all of the insurance companies I have enabled in my maintenance menu and I can double click them. I can edit, their zip code or any of the information here. Make sure you set your plan type. But here is what we're looking for, these plan requirements. Okay, so plan requirements are things like require auth code for transition. It will block a claim from being created until an auth code is entered. Okay, and you can see there's lots of settings in here. Okay, once the system passes those checks, it has a progress note, it passes the plan requirements, it's gonna allow us to transition our appointment. So we'll go ahead and take a look. Okay, and here's the appointment that we created today. You'll notice I can change any of these filters at the top and then click retrieve appointments again, but I can change the dates. I can look at only a primary payer, patient group, or location if I want to do it, separately. For our example, I'm going to transition this selected. I want to make sure that I have the right selection here. Okay, so you can say charge the card on file, apply the credit balance. In my case, I'm going to say no payment. Okay, and I'm going to transition this selected. Okay, now that just created a claim. So the system looked at the appointment record, it looked at the client's demographic record, and it used all the information we provided to create a claim, but it also did some things behind the scenes. Okay, it calculated the unit fee. So using that kind of pyramid thing that happened earlier, that I showed you earlier, you can see that it used the default service pricing. Okay, but there's ways to override that default service pricing. So let's take kind of a spin through. How do I change that service pricing? I showed you how to set the default. I'm going to go back over to ClinicTracker and I'm going to open this client's demographic information. Okay, and on the insurance tab, there's a service specific fee. And this is where one way you can override the pricing. Okay, another way is here under settings, and then fee schedules. And then you'll notice you have configure fee schedules. This is used when we have an insurance company or other payer that has a different fee than what you're going to charge. You also have configure reduced fee schedules, and you're going to use those when you are charging a client directly and you have a sliding scale. Okay. For now, I'm going to focus on these fee schedules that are payer specific, and we'll choose a case management service, and we'll say that Medicaid charges differently. So I'm just typing in my rule name here. So Medicaid. And then I am going to type in my actual fee. Okay, so the actual fee is the total amount that goes on the claim, and the allowed amount is what my contracted reimbursement rate is. So I'm really expecting $100 back, but I want to bill out the full 125 just in case they pay me more or in case I want to take the audit adjustment. Okay, lots of other options down here at the bottom to filter these. So maybe it's program specific or credential specific. Okay, so you'll need to evaluate your fee schedules to make sure you get them entered correctly. If you need help, you'd let us know. When you're all done, you can save. Okay, if anybody has questions there, let me know. Okay, going back to settings, we talked about the reduced fee schedules, okay? And again, those are going to be when you're using a sliding scale, self-pay, gross income kind of windows with people in the family size. In order for the reduced fee schedules to be applied on the demographic form, financial tab, you need to ensure that this reduced fee eligible is checked off for the client. And then when it's a self-pay, we're going to use this fee as opposed to the service fee. Okay, if there are any questions, let me know. And we're coming right back to the transition log. Okay, we talked about the various ways we can set up pricing overrides. Okay, you can also add modifiers that have fee adjustments. So sometimes we need to add a 9.5 modifier when the location is telehealth. Okay, so I'll show you how to do that. We're going to come back to Billing Tracker. Okay, in settings, under modifiers, modifier rules. Okay, this is where you can have a rule name, and then you can set your criteria at the top where it says input. So it's basically saying if the Perryville location is selected, then add this 9.5 modifier. Your location might say telehealth. Okay, at the very bottom, you can see that we're adjusting the fee by $10. So that's going to actually be added on to my service fee. Okay, if you need to make a negative adjustment, you could say minus $10. Okay. Going back to the transition log. So we talked about all of the fee stuff that happens. Okay, if there were override rules, you would have seen them here. Okay, so override rules help us adjust our claim based on specific items. So settings, override rules, and then we have things like billing clinician overrides. Those are in addition to things like that bill under supervisor. So this rule says if the service is case management and the insurer is Blue Cross Blue Shield and the clinician is Alicia, we need to bill under Chris. So under this very specific scenario, we need to use a different NPI. Okay, so you can kind of see that this is pretty easy to set up. Okay, what we're hearing a lot of questions about lately are these two, the location type override, either at the claim or service level. So most of the time, people are setting up a telehealth building in that building input form I showed earlier. On that record, they're setting the type of location to be telehealth. But what we need to do for the service location is also change it to be telehealth. So this might be our service. Oops, sorry. Okay, and then what we'll do is we'll say any service, all services, all payers, all programs, if the place of service is Perryville, which is my telehealth location, all clinicians, all credentials, I need to use the telehealth indicator. Okay, and then I would save that. And now as my claims are being created, those location overrides are being applied. Okay, now since we transitioned that appointment, what we can do is come to claim management and we can queue it up to go out. So what we're gonna do is we're gonna look at our queued claims. In my case, I wanna look at electronic, but also notice that you can print your insurer statements and your paper claims from here as well. Keep in mind the type of claim and the way it's gonna print out are set up under that insurer plan. Okay, so when I come over to the claim details tab, you notice I can set my default claim format. I can set up my transmission type for that electronic claim if applicable. If I'm using paper claims, there's lots of settings in here for you to look over. And if you're using electronic, there's settings as well. Okay, and this just tells the system what information to put where in the claim for this payer. Okay, keep in mind again, those override rules can be really helpful. So you might have a claim format override. You might have to drop to paper if it's IOP. Okay, or I might have to send as institutional as opposed to professional using a transmission type override if it's IOP. Okay, I'm going to come back to the claim management screen. Again, we're looking at electronic claims. We're going to look at everything that was queued up. I'm going to say back a month just so we have some data to look at. And then we're going to say all payers locations, and we're going to choose the professional transmission type I have configured. And here are all the claims that qualify. This is where I can highlight all the claims I want to batch up. Okay, but the system is going to see that Andrew has a lot of claims in here. So what do we want to do with them? Okay, so do we want to set claim combining rules? That's again under settings and then options. And I'm going to this time use the binocular button and I'm just going to type the word combine. Okay, and so if I look at the electronic claim combining rule, I don't have anything set, so it would not combine my claims, but I could choose one of these options if I did want to put them together. Okay, if anybody has questions on that, let me know. There's also lots of other settings in here that you'll want to take a look at. So you can see there's some CMS settings, UB04, all kinds of stuff. Okay, coming back to claim management, we'll process these claims. Okay, again, it's just looking at those insurer plans, seeing what it's supposed to do with everything. Okay, and it's just letting me know that I had an error, and my error is that I don't have a license number. So I kind of bypass that because I know what it is. And I'm going to say, yeah, I do want to open my FTP utility to submit that batch. This is where I would connect and upload the file through FTP. Okay, so that's how I can submit directly through FTP. If instead you go through an insurer portal, you can find that batch that we just created by coming here to review submissions. I can look at all the electronic batches that were created today, and I could pull up that claim batch and say, find it in the file. So I just locate the file, and here is the file I would upload to my payer portal. I would just upload this file. Okay. And you'll notice we even give you a little shortcut to your payer portal if you tell us what it is, where you can click web and that will open the payer portal so you can submit the file. Okay, once the claims are submitted, I personally like to highlight them all using my shift key. And then I right click and I change the claim substatus to submitted. Okay, so sent to clearinghouse. Okay, and then my automation also put a billing note on there. So a billing note helps us kind of keep track of when I need to follow up. Okay, just so you can see what it looks like, I'm gonna right click and I'm gonna add a billing note. Okay, so the billing note, I might say uploaded to clearinghouse in batch number 61, and you can see that right here. Okay, and then I can say, there's follow-up required in 2 days. And you can see that I had a template already set up that marked my days for follow-up and gave instructions to my team. I'm just going to save this billing note. It will go to all 9 people. Okay, those billing notes appear right here in my billing dashboard. This is where I could come in and say, show me everything where follow-up is required but not complete. Okay, and here are all the tasks in my demo system that haven't been complete, including the ones we just did. Okay, when I'm done with the follow-up, this is where I can highlight them here and right-click and mark as complete, or I can check off multiple and mark them as complete once I confirm the entire batch was accepted. Okay, I can also make follow-up notes. So I could say create a billing note, and I could say, well, it was accepted, so now I need to follow up in 45 days or 30 days. Okay, and that just let me know I had a bunch of notes on there, so it was asking, do I want to proceed? So I said no. I'm going to close out of here, and I'm going to come over to settings, and I'll show you that this is where you can set up those billing note types. So I had some templates configured, and you can see how to set them up. You just name the note type. That's what's going to appear in the drop-down. You can put in your default text, and you can put up your follow-up required items here. Okay. If it's an item where the task should automatically mark itself as complete if the claim gets paid, like those claim follow-up tasks, you can mark this, and then the system will go ahead and take care of those tasks for you. If you want to make billing note automations, that's also here under settings and then billing note automations. Okay, and this is where you could say when the claim substatus is changed to sent to payer, then I'm going to automatically apply this uploaded to clearinghouse note type. Okay. Other options in here include things like I was paid less than that allowed amount I set up on my fee schedule. Okay, so you might want to get a follow-up task for that. Okay, when the payers adjudicate your claims, you followed up, you used your billing dashboard, and then you receive payments. This is where you can come in and manually collect payments under the patient, insurance, or electronic remittance advice areas. If it's a paper check, you'll use the insurance payment form, and this is where you can come in and say, I got a paper EOB, I should say, rather than check, a paper EOB from Blue Cross Blue Shield. They paid me $1,000. Sorry. And here's the reference number, and I can go ahead and start applying that to clients. So I would just find my client that's listed on that EOB, and I can start applying the money to each of the claims. Okay, so I could say, well, they paid 95 here, and you'll see that's going to zero out the updated payer balance, but there's still a balance on the claim, which probably is assigned to the client. And I can tell that right here by clicking the balance assignment button. Let's click it for the next one down, and it kind of shows me what's assigned to whom. Okay, so I might say here they paid me 200. Okay, and now you'll see the updated payer balance is 35. What do I want to do with that? I want to assign it to the next payer, which is the client themselves. Okay, I'm going to click apply payment. You'll notice it just presents me with this find form saying, who's the next patient on the EOB. I'm going to say I'm going to lunch. I'm not going to continue. So I'm going to close out of here and save this as a credit balance. Okay, so now I can come back to it. When I come back into this form, I can select Blue Cross Blue Shield and click apply credit balance. Okay, going in back in and going to the electronic remittance. Keep in mind, we have a full webinar for this particular tool, but I'll just show you, this is where you can do really the same thing I just did, except for all the information was entered for you and it was matched up to the claim. This is where I could come through and apply these payments. Okay, when you're done, we have some reports. We have aging reports. A really nice one is this point in time aging. It helps you close out your last month. You also have claim reports and payments. Any questions on what we covered today? We've been through a lot, but I think we've accomplished all of our learning goals. Questions on any system-related topics? Billing checker, clinic checker questions at all? Okay, I don't see any questions, so we'll go ahead and wrap up for today. But if you do have questions after today, please don't hesitate to contact us. There's a very simple little button right here where you can say submit support ticket, and you can ask us your questions right from here and we'll email you back. Okay. No questions, so we'll wrap up. Thank you so much, everybody, for joining today. I appreciate your time and I hope to see you on the next one.